Hello and welcome to Homeopathy Simply Explained. I'm Petra Merker, a naturopath for classical homeopathy in Darmstadt. In today's seminar on MECFS, we'll be talking about the autonomic nervous system, which is out of balance in MECFS. As always, I'll give you an overview of the topics you can expect today. First, we talk about the effects of the sympathetic nervous system and G-protein coupled receptors. Next, we'll talk about the activation of the parasympathetic nervous system, the homeopathic remedy Hyoscyamus and conclusions. Next, we'll look at the homeopathic remedy Belladonna and the case from Dr. Höring. We'll then move on to the homeopathic remedy Stramonium and take a look at the brief comparison of these remedies by Nash. Finally, we'll look at the homeopathic remedy Curare. From the miasmatic of MECFS and the history of head injuries, today's seminar section will focus on the autonomic nervous system, which is imbalanced in MECFS patients. In homeopathy, we have an important quartet of remedies for this topic, which, through their anticholinergic properties, counteract the effects of the parasympathetic nervous system, so that the sympathetic nervous system no longer has an antagonist and remains actively in the foreground, as is the case with MECFS patients. For this reason, today we look at the effects of the sympathetic nervous system and illuminate the homeopathic quartet that can lead to the activation of the parasympathetic nervous system. Of course, in homeopathy we have many other remedies that have an effect on the parasympathetic nervous system, but we cannot discuss them all. The sympathetic nervous system, which is part of the autonomic nervous system, is responsible for depleting energy reserves because the body is being put into a state of readiness for performance. This is also the reason why energy reserves become depleting in MECFS patients, as the parasympathetic nervous system, which could help replenish energy reserves, is insufficiently active. The sympathetic nerves communicate with each other via neurotransmitters acetylcholine and noradrenaline. The adrenal medulla, which releases adrenaline and noradrenaline into the blood, acts as the interface between the autonomic nervous system and the hormonal system. The sympathetic nervous system puts the organism of MECFS patients into a persistent fight or flight mode, leading to dilated pupils, reduced saliva production, dilated bronchi, increased heart rate, constriction of blood vessels, and reduced activity of the stomach and intestines and their glands, such as the gallbladder and pancreas. Furthermore, the adrenal medulla is stimulated to release adrenaline and noradrenaline. MECFS patients also usually exhibit autoimmunity against G-protein coupled receptors, which are responsible for transmitting signals into the cell interior. G-protein coupled receptors are responsible for processing sensory stimuli such as light, smell, or taste. They also play an important role in inflammatory processes, cell movement, the transport of substances, cell growth, and cell differentiation. G-protein coupled receptors also ensure the action of hormones and neurotransmitters. Some viruses use these receptors as a point of entry into the cell. Virus medications act on G-protein coupled receptors such as beta blockers, neuroleptics, antihistamines, opioids, and sympathomimetics, as well as triptans, serotonins, and sartans. The image shows an example of a laboratory test demonstrating such autoimmunity. Homeopathic remedies also have effects on these receptors. Among other things, the medicines Hyoscyamus, which we are discussing today, and Belladonna are worth mentioning. In contrast to the sympathetic nervous system, which is controlled by the spinal cord, the parasympathetic nervous system, our recovery nerve, is controlled by the medulla oblongata in the brainstem. Only the bladder and genitals are innervated by the spinal cord. The parasympathetic nervous system constricts the pupils and bronchi, stimulates the gastrointestinal tract and its glands, increases saliva production, and lowers the heart rate. Medications that inhibit the parasympathetic nervous system are called parasympathomimetics, and they enhance the effect of acetylcholine. Let's take a quick look at the mechanism of action in the synaptic cleft. Here we see a parasympathetic nerve cell releasing the neurotransmitter acetylcholine to an effector cell or nerve cell. On the receiving cell, the acetylcholine occupies the M receptors, which are G protein-coupled receptors, activating the parasympathetic nervous system. If the patient is given a parasympatholytic, this displaces the acetylcholine neurotransmitters from the M receptors and thereby inhibits the parasympathetic nervous system because acetylcholine can no longer exert its effect. Since in homeopathy we treat like for a weakened parasympathetic nervous system, we use medications that are able to weaken the parasympathetic nervous system in order to strengthen it. In homeopathy we have several remedies available, of which we will look at in more detail today. I'm talking about Hyoscyamus, Belladonna, Stramonium, and Curare. The first three homeopathic remedies also represent the well-known triad of homeopathic remedies that can be used for delirium. As we already heard in another video, Hyoscyamus, henbane, like the other homeopathic remedies presented today, acts on the M3 receptors against which some MECFS patients have autoimmunity. In the homeopathic remedy picture of Hyoscyamus, we find numbness. The patient twitches and plucks at something or grabs at the air, but otherwise lies still. If the patient is delirious, it is usually a calm delirium, with occasional violent outbursts in which the patient bites, cures, insults, or fights. We are dealing with a confused patient who sometimes undresses or touches their genitals. They talk to deceased loved ones and are afraid of being alone or of imaginary animals. The patient is restless and wants to escape. The face is pale and the patient suffers from increasing weakness of body and mind until even urine and stool can no longer be controlled. Muscle switches may occur. The patient becomes suspicious and may lose his speech due to shock. Septic fever may also occur. Hyoscyamus' drug picture includes drowsiness and inability to think, and the patient is difficult to awaken. The eyes may be open and stare into space, or they may be tightly closed and difficult to open, with rolling eyes when opening. Patients then need assistance opening their eyes, for example, by lifting the upper eyelid. A locked jaw or constriction of the throat with an inability to swallow liquids may also occur. The sense may be impaired, such as numbness due to paralysis of the auditory nerve or loss of smell and taste. Hiccups may occur after a head injury. Paralysis of the sphincter muscles can lead to involuntary urination and defecation. Nervous overstimulation can lead to insomnia, or the patient may fall asleep in the middle of a conversation. Arousal from sleep with a start or a deep sleep from which the patient is difficult to awaken also occurs. Hyoscyamus patients are sensitive to touch, cold, and emotional states. In a previous video I mentioned that I also used the remedy Hyoscyamus on our daughter. The explanations regarding the concussionous issue from the video head injuries were from May 3rd, 2024. 2 days earlier, I had started the homeopathic remedy Hyoscyamus C30, which helped our daughter become aware of the problems associated with her illness. For our daughter, the illness at that time, while bedridden, was similar to the persistent vegetative state. It was like being mental deranged but with full concussioness. Her eyes were closed and she couldn't open them because her muscles weren't functioning properly. She lay there with her eyes closed, unable to do anything, yet still aware of everything in bright moments. She also couldn't sleep because she was too stressed. The vision in her left eye also improved with Hyoscyamus. Our daughter initially began to experience blurry vision. The right eye improved somewhat later until her vision was restored. Belladonna poisoning causes facial redness and dry mucous membranes. This is accompanied by thirst, difficulty swallowing, and hoarseness. The heart beats repeatedly, the eyes are luminous, and the pupils are dilated. Motor restlessness develops, accompanied by an urge to talk, hallucinations, and severe delirium with fits of rage that culminate in exhausting sleep. In the worst case, cardiac arrests or respiratory paralysis occurs. The homeopathic drug picture shows congestion in the head, blood rising upwards, and a flushed face. The patient is easily startled, especially when falling asleep or waking up. Painful seizures or neuralgia may occur. The patient feels warm and is sensitive to light, noise, and vibrations. The senses are generally hypersensitive. The patient is easily startled and groans a lot. Belladonna patients are absent-minded and forgetful. The dizziness worsens with moment. They exhibit great nervous excitability. All sense organs are overstimulated. There is a feeling of head fatigue. When dizzy, the patient tends to fall to the left or backward, and unconsciousness may occur. The dizziness is aggravated by any movement and may be accompanied by nausea. Flickering before the eyes is also described in the Materia Medica in relation to dizziness. There is a strong congestion of blood to the head. The cerebral vessels are congested and tense, and the return of blood to the venous circulation is impeded. The coldness in the brain is felt. There is also inflammation of the base of the brain and the medulla oblongata. Belladonna has a tubercular tendency with swollen lymph nodes. The skull feels as if it is paper thin. The head is sensitive to touch, even the hair causes pain. When the eyes are closed, the patient drifts into a state between being awake and asleep. Dr. Herring describes a case on this topic in his Materia Medica. I quote, "A girl 18 years old suffered from cerebral congestion, sudden heat in the head while the rest of the body was cold, dizziness, burning and throbbing forehead pain, noises in the ears, and visual illusions. Her headache intensified, the pulsation of the parotid glands increased, and then sudden blindness. She has a wild look, a stupefied appearance. Her eyes are restless, uncertain, and blank, with occasional flashes of light. Her face is reddened, her breathing is anxious and irregular. The eyes become dull and lackluster." End of quote. With Belladonna, we are dealing with orbital neuralgia and inflammation of the optic nerve. The eye moves spasmodically and twists. Facial neuralgia or lockjaw may also occur. The speech organs exhibit paralytic weakness. The inner parts of the mouth are also affected. Saliva is thickened like glue, and there is increased salivation. The throat constricts, and a feeling of choking may occur. This symptom may worsen during swallowing. The epiglottis feels sore and raw. The esophagospasm, making it difficult to swallow food without liquid. If the patient does not swallow, a feeling of choking may occur. The constriction can also be felt in the chest, and there may be pressure on the chest, which also affects the heart. Patients feel palpitations in their head, and the pressure in the heart area takes their breath away. The pulse is usually rapid, but can also be slow. The neck is stiff, and there may be pain in the spine. The knees are weak and buckle, the legs heavy and shaky, even leading to paralysis. The feet may be ice cold, and coordination problems in the arms and legs may occur. The extremities may be twisted, and there may be severe fatigue and stiffness of the muscles. Weakness with fainting spells or extreme drowsiness and somnolence may also occur. Patients may be in a half-awake, half-asleep state, aware of everything or not asleep at all. Sleeping with half-open eyes, as is common in MECFS patients, is also found in the drug picture of Belladonna. Let's look at the drug picture of Stramonium. Stramonium, or thorn apple, poisoning leads to increased excitement, hallucinations, nausea, dilated pupils with visual disturbances, which is an important indication for this remedy in homeopathic and respiratory paralysis. We are dealing with typical respiratory paralysis. We are dealing with typical anticholinergic symptoms such as dry mouth, dry skin and mucous membranes, dilated pupils, flushing fever, flushing excitement, hallucinations, and delirium. Other symptoms include thirst, difficulty swallowing, visual disturbance and sensitivity to light, urinary retention, constipation, vomiting, repeat pulse, palpitations, low blood pressure, movement disorders, repeat respiratory rate, excitement, psychosis, aggressiveness, belligerence with a desire to fight, coma, disintegration of muscle tissue, liver inflammation, and ultimately cardiac and respiratory arrest with death. The homeopathic drug picture, we find complaints of psychological shock and post-traumatic neuritis with a desire for company and talk activeness. Patients who require Stramonium tend to be restless and want to be active. The homeopathic physician Eugen Nash, in his case Symptoms of Homeopathic Therapy, drew a brief comparison of the homeopathic remedies discussed so far. I quote, "Of all the remedies, Stramonium is the most talk active. Hyoscyamus is the most numb. Belladonna is in this respect midway between the two. Stramonium tosses and jerks his head out of the pillows. Hyoscyamus twitches, plucks, and grabs the air, but otherwise lies fairly still. Belladonna starts or jumps when falling asleep or waking. All have a temporary desire to escape." End of quote. The next and final drug in this series is used by rainforest people as arrow poison for hunting. Curare alkaloids displace the acetylcholine from the nicotinic receptors and thus prevent the transmission of the signals from nerve cells to muscle cells, leading to muscle paralysis. The poisoning ultimately leads to respiratory paralysis, which leads to death. Thus, poisoned are muscularly paralyzed but still feel pain in the paralyzed parts, although they are unable to express this. Claude Bernard, who conducted experiments with frogs and arrow poison in the mid-19th century, described his observation, and I quote, "Can you imagine a more terrible torment than that of an intelligent being who must witness the progressive deprivation of all these organs, and who is now, so to speak, enclosed alive in a corpse?" End of quote. Some MECFS patients feel exactly the same. Their mind is fully there, but their body is so weak that it no longer obeys it. It's like being buried alive. But from 1870 onwards, Curare was also used for the symptomatic treatment of tetanus. In the homeopathic drug picture, we find exhaustion after physical and mental exertion, muscle paralysis without impairing the sensation of pain or concusiousness. The arms are weak so that the fingers can no longer be lifted. The legs give way and tremble when walking. Paralysis of the face and cheeks, and impending respiratory paralysis when falling asleep, or shortness of breath and fainting are also included in the drug picture. Reflexes are weakened, and diabetes or liver cirrhosis may be present. The brain feels full of fluid and there is hair loss. The mouth and tongue may be twisted to the right side. These 4 remedies are usually used when autoimmunity with the inflammatory reaction is predominant. Here, depending on the need, work can be done both on the organic level with low potencies and on the energetic level with high potencies. I conclude today's section with this excursion into 4 other important remedies that can be used for MECFS illness, depending on the individual symptoms. I hope you gained some new insights and will join me again next time.